We're live.
We're live.
Hello,
We're live.
Dr. John Rothwell. How are you today?
Good morning, Miss Janice Polk. How are you?
I'm great. I'm great.
Well, let's welcome everybody to Outside the Box 2020 Healthcare Edition. So it's good to have everybody here today who's maybe took advantage to get on time. We're kind of 9 minutes late, so that's my fault.
No. I scheduled us for 11:45 because I know us.
We're early.
Yeah.
We're early.
Yeah.
Good.
So we're actually early. We're like 6 minutes early, but that's a fake because, yeah. It's like there's people. There are people who set their alarm clocks to like trick themselves. So it's kind of the same thing that we did.
Gotcha. Now, are we on Clarity-Based Marketing or are we on your website?
We are actually in 3 places because we're using StreamYard today. And I wanted to test it. We've used StreamYard before. And the reason we're using StreamYard today is because we should be able to answer and interact with people live. So if anyone is watching and wants to interact with us live, they can do that. And we should be able to see those comments and speak to them. And so StreamYard lets us go live in 3 places at one time. How about that?
That's pretty cool. So, and are we on YouTube or which YouTube channel?
We are on the Outside the Box YouTube channel, and we are on the Just Janice Facebook page, which is Just Janice, business consultant. And then we're on my personal profile, Janice Polk.
Awesome.
Yeah. How about that? We're fancy.
Nice. Fancy.
Right? So, Dr. John, introduce yourself, if you will. I always like it when you do that.
Well, welcome, everybody. My name's Dr. John, Doctor of Nursing Practice, Advanced Practice, Registered Nurse, Family Nurse Practitioner, Board Certified. And I am joined and welcomed by Miss Janice Polk from Clarity-Based Marketing. So thank you for having us. It's a little different every time. So
it is. It's a little different. That's okay. I like that. I like being a little different. So today we're going to talk about an interesting subject. I think it's interesting anyway. So we talk about women's hormones all the time, both positive and negative. Women get blamed and credited for a lot of things hormone related. But what we don't talk about very much is men's hormones. And so that's just as important. Hormones matter whether you're male or female. And for men, it matters more and more the older that they get. And so, nobody ever talks about it, though. It's like a taboo subject. So we're going to talk about it today. I love talking about taboo subjects. I like it.
Right. And in all actuality, I don't even think we joke and stereotype and judge women on their hormones more so far on this show. We really haven't delved into a lot of stuff too. So I think we should definitely take that up as a topic, but it's much more complex in a lot of different ways. And when it comes to men, like you said, it's kind of taboo. Guys don't want to talk about it. It's interesting. So I had a patient this morning who came in and said, "Hey, Dr. John, so-and-so, who's also a patient of mine, asked me if he could have a couple of my blue pills. And I didn't, I wanted to talk to you first to see if it's okay to give him my blue pills." I go, it's okay. It's not okay to give your medicine away. And I go, "Why doesn't he want?" He goes, "Well, he's a little embarrassed because if they don't work, and he's a guy." And I said, "Listen, just tell him, Dr. John always tells the wives, I take care of blood pressures and boners. So that's how we get the husbands and the boyfriends into the clinic." And so it's amazing the stereotype that men give themselves and the negative perception that comes across with men and the decreased libido, the decreased functionality during sexual intimacy and those kind of things. And so they're constantly like, they don't want to tell anybody. It's like they want to keep it secret, like it's a bad thing. And we're used to going to our primary care providers and going, "Hey, I have this issue," and they go, "Well, that's just normal aging." Oh,
That's so
you're going through,
frustrating.
yeah, you're going through menopause, so you should have hot flashes and a dry
Mm,
vagina. It should hurt,
mm,
and
mm.
and that's not
So
true.
frustrating.
And so, and with men, it's, oh, well, you should be able to keep an erection and you shouldn't be able to have an orgasm, for 45 minutes or an hour. And while, the real expectations is that, sexual intimacy in that fashion doesn't last for an hour or 2 hours or stuff like that. It's just not the norm. And so when it does, it can be frustrating, especially if both partners are not being satisfied, right? They're not getting the enjoyment out of it, and it becomes frustrating. And then who wants to do something who's frustrating? We do that now. We're frustrated and overwhelmed with our healthcare, so we don't go to the doctor.
Who does that?
A lot of people, right?
This
And
girl.
then when they
Yeah,
come here,
sometimes.
yeah, they come here and there's no copay, no deductible. And so we, early on, we see them quite a bit until we kind of get in a rhythm and kind of figure out what's going on. So when it comes to men's hormones, the number one hormone that everyone talks about is testosterone. And you made a comment earlier, which was, about age. And it's interesting. So testosterone, low testosterone doesn't have an age. I have substantially a great number of young men who are in their 20s, that's their prime, have low testosterone.
Really?
Yeah. And so, and you don't want to replace their testosterone uh, in the traditional sense, because once you start replacing testosterone, you suppress testosterone. The body stops making it because it's there. I mean, that's what you do in balancing hormones. You're balancing one so that the brain says, you're giving some, so the brain says, don't make any more, or
You
you're
know,
taking some away.
I want to say something about that because that's very interesting. Someone very special in my life has type 1 diabetes, and that's something that we learned when she was diagnosed, is that when someone who's type 1 diabetes, in the beginning, their pancreas is making a little bit of insulin, but not what it's supposed to. And then over time, when you start supplementing with insulin, to do the job, the pancreas just goes, psh, that's being handled. I don't have to do it at all anymore. And so it stops producing insulin completely because it's being provided somewhere else. And so it sounds like kind of the same concept. I did not know that about hormones.
Yeah. So insulin's a hormone.
That's interesting. But
Yeah.
I didn't realize that insulin was a hormone.
Yeah. Yeah. So
Interesting.
yeah, it's hormones are so complex, and our bodies are actually run by the thyroid hormone, right? Thyroid is metabolism, it's body temperature, and it's all interconnected, including to our sexual hormones. And so when we talk about women, we talk about estrogen and progesterone and testosterone, amongst a few other things, but those are kind of the main ones. And with women, estrogen's broken down into estrone, estradiol, and estriol. So there's 3 different estrogens, and as the aging process goes on, the women have more of one than the other, and then that's the one that causes the side effects. So you want to decrease that one and elevate the other ones, and those kind of things. When it comes to men, have a decrease in testosterone and often an increase of estrogen. And
Okay,
then
I didn't know that either.
yeah, and so what happens is sometimes men actually replace their testosterone, and what their body doesn't use for testosterone then converts into estrogen. And so it's important for them to monitor their blood work, so that there's a balance between total testosterone and free testosterone, and a balance of the estrogen. And so I had a patient the other day who said, "Hey, Dr. John, I've cried more in the past 2 weeks than I have in my entire life." And so we kind of look into it, and, there may be an excess estrogen or even a depletion of estrogen. I'll talk about myself. So my testosterone is actually quite high for a guy my age, naturally high. And I supplement with DHEA, which is a precursor to testosterone. And I want to build a little bit of muscle because I'm still playing rugby. I want to keep those age things out of the way, right? So making sure that, erections are normal, and, they don't get soft too soon, and all that other good stuff. And so my testosterone is good, but my free testosterone is actually very low. And come to find out, my estrogen is actually quite high. And so I always just thought I became a male nurse first because I was overly sensitive and compassionate, and it could very well be just because I have a little bit more estrogen than the average dude. So I cry at the Doritos commercial. It's crazy. So not really.
Which a lot of men are emotional like that, but they hide it because our society in general says that that's not masculine, which is silly because it is. It's human.
Sure, it's human. And the only time we kind of want to do anything about it is when the man boobs come around, or the penis doesn't work anymore. And so it's just like, why wait till it doesn't work anymore? Right?
Yeah.
Why not put the body in a natural state using bioidentical hormone therapy, right? So creams or gels or even injections for testosterone.
Okay, stop. That's a term. So I'm sorry for interrupting you. I'm going to do it a lot because I don't understand a lot of this stuff. A lot of this that you're saying is all new to me. But what's striking to me is that some of the terms that you're using are terms that I'm familiar with when it comes to women's hormones, like bioidentical hormone treatments. And, you hear that all the time when it comes to women, but I don't think I've ever heard anybody say that term as it relates to men's health.
Yeah, sure. It's a huge part of men's health.
Okay.
And, when we talk about bioidentical hormones, we're really just talking about non-synthetic, right? We want the pharmacist, oftentimes it's a compounded pharmacist. They will take the structure of the natural hormone, combine it with a carrier, right? So, some kind of cream or whatever that's natural and holistic, something that the body will absorb so that the male or female actually get maximum absorption from that hormone. And so testosterone, some people don't like injections. Oh, I don't want shots. They don't know that you can get testosterone in a cream or a gel. And so depending on what their levels are, kind of depends on what you should do for your transport for testosterone into the cells. And what a lot of people don't realize is, even though the FDA, so the Federal Drug Administration, testosterone is not necessarily an approved therapy for women, it's considered off-label. There's quite a bit of research that reports that women benefit quite a bit from testosterone, especially both men and women. Helps cardiac health, can help lower cholesterol. There's a tremendous amount of benefits when balancing your hormones down to your 25-year-old age, because that's when you should be at your healthiest, right? And so you kind of stop growing, and now is when you should be your healthiest. Now, unfortunately, most of us, that's when we do most of our beer drinking and all the other things. But and that kind of happens. And then what happens is then we get married, and then we have kids, and then we have the dad bod, and then we can't get rid of the dad bod, have the little poochy belly. And a lot of that won't come away because our testosterone drops. So we have a decrease of muscle mass, our bones are weaker, and we have weight gain, and we have a hard time losing weight, and our estrogen is high. And so you got to balance.
And they don't know it.
And they don't know it because you're afraid to go tell somebody about it.
That's right. So let me loop back for a second, because one of the things that you said that's stuck with me, it's kind of stuck in my head, is if you supplement, that your natural body production will go down because it's being supplemented. So that sounds like an argument for going and actually getting tested to see what's going on, to see whether your body is or isn't producing, because maybe it's your hormone level and maybe it's something else that's creating issues.
Sure. So one of the things in traditional medicine is, we don't, not that the providers don't want to get to the root cause of what's going on. They don't have time, right? Because they're battling the number of patients they need to see to meet the requirements to get reimbursed by the insurance company. And so with your direct primary care practices, many of us 30 minutes to an hour. So I only see one patient an hour. So when I do that, I can really focus on the root cause of what's going on. And so we want to know what's causing a symptom, what's causing a patient to feel something, what's causing a dis-ease. And we like to say dis-ease versus disease, because usually the dis-ease comes beforehand. So we can find out that your erectile dysfunction is caused by a depletion in testosterone and excess of estrogen versus cardiovascular disease, right? Versus diabetes. Or do we want to make sure that it's not diabetes? So in other words, we're checking out, and if you carry on living the life the way you're living, you have an increased risk for diabetes and coronary artery disease, and you're obese. So let's fix the obesity so that all these other things don't happen. And so that may just be the start. So why are you obese? Well, I can't lose weight, John. Why can't you lose weight? Because you have excess estrogen and not enough testosterone. So, and your lifestyle is frustrating. And since you're not getting that instant gratification, which is the culture we live in, we don't lose 10 pounds in a week. So we give up. And, you know, so it's this vicious circle. So we go to fad diets and those kind of things. And so at Island Direct Primary Care, we talk physical, mental, emotional, spiritual, and financial wellness. And so part of that is changing people's mindset, meeting people where they're at. And then as the mindset changes, then they realize that, you know what, I can do this. And I got someone that's helping me and somebody who cares about me. And so now they care about themselves. And then we start chipping away. So we balance the hormones. So we balance maybe the sexual hormones. And then we balance the thyroid hormones, and then the weight starts coming off. So the primary goal for the patients, usually the weight, because we're all kind of prideful and vain. We want to like what we see in the mirror.
Sure.
Before we give it and share it with other people. And so, you know, from a medical perspective, though, we want to look at the underlying root cause of it so that those changes are sustainable. Right. And so that's where it comes into play. So,
and it can be a head game too, right? I mean, stress and cortisol. Cortisol is a hormone too, right?
Yeah. And so stress, the release of cortisol, excess cortisol becomes this vicious cycle. If you constantly live in a fight or flight or hide status, right, then you have cortisol burning, going all the time until you just burn out.
Yeah. And
so that causes weight gain and stuff too. And then they give you medication that tries to help that, and that medication causes weight gain.
So it sounds like a pretty complicated subject. Like a lot of health matters. It depends on the person.
It always depends on the person. So you look at the individual, and you look at the lifestyle of the individual, what they're going through. And that's why I think it's just so important to just really get to know your patients and have the time to do that so that you know what they're going through. So they may be going through something at work. They may be something going with their partner. They may be battling with their own identity. They may have some kind of illness, chronic illness, congenital, which is, birth, from birth,
right.
Some kind of development delay. You just never know. And so you really got to look at all those things as a whole and then start work on them. And at the end of the day, none of it fixes or changes until you change it in the mind. Right. And so the mindset has to change. And then often we have to change it in the gut first. So I know I think one of your viewers, Candy, talked about gut health. And so we need to talk about leaky gut. Maybe we can do that next week. So you talk about gut health. So you fix the gut so your body absorbs in the way it's supposed to. It releases the neurotransmitters the way it's supposed to. And then you get the hormones working. And sometimes if the thyroid's off and it's sluggish, then your sexual hormones, are not balanced. Some people's thyroid's okay, but their sexual hormones are off balance. And so,
and these are things that you really don't generally talk to your doctor about, because we have preconceived ideas about it. And then, when it comes to men's health, you have that additional layer of, the masculinity thing. They don't really want to go in and say, hey, I have this issue, or, are my hormones messed up, or even open this conversation, because it might not be their hormones, but they don't really want to talk about it. At the end of the day, they just really don't want to talk about it.
My dad, bless his heart, was sexually inactive for quite some time. And when he met his girlfriend, fiance, before he passed away, the first time he goes, hey, son, what do you think about Cialis or Viagra? Right. And so we talked a little bit about, those medications, which were originally developed for blood pressure and pulmonary hypertension. And so,
right.
So with him, it was funny. He got a prescription for Cialis, which is the date medication. I call it date because you don't have to use it within 4 hours. And so you can take your girl out on a date first and wine her and dine her before intimacy time. And so we got him a prescription for Cialis. He used it 3 times and then he never needed it again because everything was here between the ears, not between the legs. So it's not always that way. And so sometimes it's just a confidence thing and those kind of things. A lot of men suffer from premature ejaculation for a number of different reasons too. Cialis kind of helps things like that. So now man's happy, woman's happy. So there's a lot of things. Island Direct Primary Care, we often have the sex, drugs, and rock and roll talk. So we get very down and dirty, so to speak, so that we can really help people live the life that they always want to live, right? And so that's really
that's not easy, though. It's not easy to have those kind of conversations. I always tell people, I always say, and I told you the other day, I'm not a prude, I'm not a prude. And I'm not a prude at all. I'll have a conversation about anything, but I do get embarrassed somewhat easily. And I am a little conservative about what subjects that I will talk about with certain people. There's some people that I'll be just like, no holds barred. But most people, I'm pretty conservative about, what I would talk about. And my doctor, always traditionally was one, because in a traditional doctor setting, you see them once a year, twice a year, most of us. Like I don't like to run to the doctor, even with you, I'd rather talk to you on the phone or have a telemedicine visit. I think by this point, I've been a patient of yours for over a year and a half. I've been a patient. And if I make an in-office visit, there's a reason. Like,
yeah.
If I've made an appointment to come in and physically sit down with you, there's something that's really, bothering me. And, but even then, like, it's a process for me to gain the trust, because I have had doctors in the past that have said, oh, that's just your new normal. Oh, you're getting older. And I'm not willing to go down, that poem, I will not go quietly into the dark night. I'm not doing that. I plan to rock on until I can't rock on. So I'm not taking that, but I have that baggage coming forward into a relationship with a doctor, because we've talked about that before.
Right.
Your relationship with your doctor is really important, and you have to feel comfortable and trustful to go in and say, hey, I'm having a problem in my sex life, or I'm having, this embarrassing issue.
Yeah, and guys, they're worse. I remember seeing a little meme. It's not really a meme, but back in the day, it was a cartoon. But you have picture a little girl and a little boy, and then the little boy says, "I have stick shift and ball bearings," right? And so guys start measuring their penis and comparing it to other guys, from the time they're little. And even as grown men, I play rugby, and so guys in their 50s and 60s are always, comparing the size of their tallywhacker, and it's just like, really. And while some women think size does matter, it's not everything. And with guys, though, we make it everything, and it's this pride thing. And it's just like, I always like I told my boys, I'm like, dudes, babies come out of there. There's no penis as big as a baby. So just because you're bigger than the other guy doesn't mean a dang thing. So, but it's amazing how men think about their penis, and it's mind boggling. And we make this something from the time we recognize that all penises aren't the same size. Right.
Yeah.
And it's because we stand up next to each other and pee. And it's always, looking up and looking ahead of the wall. You don't ever want to look left or right because you don't want to be comparing. So it's a crazy thing.
It's a sensitive subject. So in a nutshell, nobody's asked any questions. I'm kind of surprised. I thought we might get some questions. Stop it. See? So if you're watching, we only have a small viewership at the moment, but if you have a question, ask. If it's not live and you're watching this, it's not live anymore, ask your question anyway. Dr. John always is good about coming back and answering questions, and that's great. I appreciate you doing that. So in a nutshell, my summary of what we talked about was it's complicated. Yeah, right? Like, men's hormones, just like women's hormones, are complicated. And the best thing to do, don't just assume it's because you're getting older that, this is happening or that's not happening. Go talk to your doctor about it, because it could be something you don't expect. Is that a good summary of what you said?
Sure. So absolutely. And so you want to make sure in men's conditions, you don't want to make sure that it's a vascular issue, right?
Right.
You want to make sure it's not
heart related.
So it could be heart related. It could be vascular related. It could be prostate related. I mean, there's a lot of different things. And so guys, women deal with female pelvic exams from the time that they're sexually active, or, and then after that, when they want birth control, to going through their annual, or now it's not annual if you've had the same partner and you've had negative results. There's a little flexibility in the guidelines depending on which guidelines you steer with. Guys, there's guidelines too for like prostate screening. But women are used to the provider going in the mission, and guys are just like, they're afraid of the finger,
Yeah.
And I got to remind them that they got poop bigger than a finger, so just relax. And but in
so important.
Full transparency, it's not my favorite thing to go do. It's just like, no, I don't want to, I don't want my colonoscopy. But when it comes to prostate cancer, we don't do the digital rectal exams as traditional guideline screening unless there's certain risk factors and stuff like that. There's other things that we can do. So I encourage, men's health is humongous in our culture. A lot of it's diet related, and all the preservatives and the unnatural things that we put in our body, our lifestyle, our sleep. Find a provider that's willing to sit down, listen to you, not judge you. In my practice, I actually eat, I can dispense medication. So I have a dispensing license. I keep the generic Cialis and generic Viagra at my clinic. And my patients can pick it up right here. And so we do it all on the side. And so they don't feel that discomfort of going into public CVS or Walgreens when it comes to.
That's a big deal. That's a big deal too. Yeah. So that makes it good. And, men take care of their vehicles so well. Usually, they take it to, either they work on it themselves or they, take it to the mechanic, but their bodies,
yeah,
not always as much.
That's right. That's right. So listen, I have a patient that I need to go see. He's been waiting on me, but I am just, I'm grateful for the topic. And I thank the audience for coming up with topics. I look forward. So let's talk leaky gut next time. And we will see you next Thursday at 11:30.
Yes. 11:30, 11:45.
Yeah. Ish. Yeah. Call 11. Yeah. Awesome. Have a blessed day.
Thanks, you too. Thanks for joining us. We'll see you next week.
Bye-bye.
Bye.